Hello, I'm John Foster, and I'm a medical doctor who does Social Security disability exams. And today I'm going to talk about a phenomenon that I have named medical catastrophization. And the reason why I'm going to talk about it is because in the past year I've seen some striking cases of it in my disability exam practice. As usual, everything I say reflects my own opinions based on my own experience and study, and not the opinions of the Social Security Administration or any other medical body. Now, what is catastrophization? It's a term I've borrowed from cognitive behavioral therapy, and cognitive behavioral therapy is all the rage these days. I think it has some pluses and some distinct minuses. It flips Freudian psychotherapy on its head. Freudian psychotherapy says that your innermost feelings, often residing in your subconscious, guide your behaviors and thoughts. Cognitive behavioral therapy's premise is that your actions and thoughts guide your innermost feelings. I think probably both opinions have some validity. It's currently in vogue to consider Sigmund Freud a misguided loser and throw all of his theories out, and I think that's a huge mistake. As Dr. Jordan Peterson has stated, we accept most of Freud's theories as received wisdom today and are only scoffing at the few things that he got wrong. If you think Freud is a misguided loser, I suggest you try to create single-handedly a whole new medical specialty and see how well that works out for you. Young physicians today might be astonished to know that before Freud's theory of the subconscious, folks suffering from hysterical conversion reactions were thought to be suffering from a physical debility of their nervous system, which was often called neurasthenia or nervous exhaustion. And those folks were treated with physical remedies rather than counseling or what we would call today psychotherapy. I'll never forget my first hysterical conversion reaction I saw. I was moonlighting in a small rural emergency department during my residency, and the ambulance brought in a 16-year-old girl in a coma. The story was that her boyfriend had broken up with her that day, and she had taken an overdose that he had witnessed and lapsed into a comatose state. On arrival, she was breathing but was unresponsive to any verbal, physical, or painful stimulus. As well, I checked with a tongue depressor and she had no gag reflex. I therefore thought it was essential that, number one, I intubate her to prevent aspiration, and number two, that I perform gastric lavage and administer activated charcoal. However, when I inserted the laryngoscope to intubate her, she sat up and began crying and immediately resumed consciousness. That's a typical patient with a conversion reaction. They're usually, but not always, female. I've seen plenty of males with conversion reactions. They're usually, although not always, younger. I've seen a man in his 70s with hysterical paraplegia. The episodes tend to come on abruptly, are always related to a nervous system disorder such as blindness, aphonia, or paralysis, and tend to be brief and resolve spontaneously. The idea is that the patient is subject to a situation which they find emotionally unbearable, and the conversion reaction allows them to exit that situation. Now, I said that I found some of the claims of cognitive behavioral therapy credible and others not. And the number one claim that I do not believe is the cognitive behavioral therapists basically assert that they can treat any mental illness with very brief psychotherapy in the order of 1 to 2 months. Traditional psychotherapy involves treatment for months or years. I think one of the reasons why cognitive behavioral therapy has become such a rage is that it allows health insurance companies to limit patients' therapy to very brief periods, which obviously will make the insurance companies much richer than paying for therapy over extended periods of time. I simply do not believe that you can alter a dysfunctional pattern of emotions and behavior that has perhaps been lifelong in a couple of weeks by teaching a patient how to think and behave. To put it bluntly, I think that's a scam. I'm sure it works in some people, but not in all. And I'm happy to announce that Keiichi, the amazing wonder dog, has made his appearance, and perhaps he'll be giving his opinions on psychotherapy in a short while. So what is catastrophization? Well, it's a term used by cognitive behavioral therapists to describe a dysfunctional pattern of thinking. Something adverse occurs in the patient's life, and the patient blows it way out of proportion and acts as if circumstances were much worse than they really were. Note, this is not an imaginary problem. It's a real problem that crops up in the patient's life, but their reaction to it is excessive. An example might be a relatively trivial disagreement with a spouse, which leads the affected person to believe that divorce will be inevitable and that the marriage is a complete failure. And that's the pattern I've seen over and over again in what I call medical catastrophization. A patient develops a medical problem, often, but not always, a serious medical problem that might even involve a brush with death. The condition is treated and a pretty good outcome occurs. However, the patient seems to be stuck in the phase where they were acutely and dangerously ill, and they act as if they're still acutely and dangerously ill, and they don't seem to be able to recognize that they have improved greatly, their condition has stabilized, and that it's time to move on with their life. They're not making a mountain out of a molehill. They've actually had to climb the mountain, but the mountain has been climbed. They've descended back to ground, but they act as if they're still hanging on by their fingertips to a sheer rock face about to fall at any moment. A common precipitating event is a diagnosis of cancer. For example, last year I had a patient who developed a lump in the breast which turned out to be cancerous. Now, that's a real problem and it's terrifying. I've never had cancer myself, but I can't imagine the fear I would have if I did. The patient was treated for the cancer with surgery, radiation, and chemotherapy, and the treatment appeared to have been successful. However, they developed a lump in the other breast, which again terrified them. This lump was removed and was found not to be cancerous. When I saw the patient, they were 3 years past the diagnosis of cancer, and there had been no recurrence. So the odds are the cancer was cured. The patient did have surgical scarring, but there was no evidence of any serious permanent sequelae. For example, no edema of the arm on the surgical side. The patient had all sorts of physical complaints and seemed to be extremely anxious. On examination, other than the scarring from surgery and skin changes from radiation therapy, I could find nothing wrong. This person seemed to have been terrified by their cancer diagnosis, and then a second terrifying by the benign lump in the other breast, and simply could not move past that, and had basically given up most of the activities of living. A second patient was a person who exercised really hard for a considerable amount of time each week, was very physically fit. They developed hypercholesterolemia and were put on a statin drug. After starting the statin, they had problems with muscle pain, which prompted them to go to the emergency department several times, where they were basically told there was nothing seriously wrong with them. To complicate the matters, the patient was foreign-born, had only been in the United States for a few years, and had very shaky English, so communication was difficult. The musculoskeletal pain got worse and worse, and finally someone made the diagnosis of statin-induced rhabdomyolysis. For the layman, that's basically a serious condition where the muscles of the body sort of dissolve, and it's a rare but extremely dangerous complication of taking statins. The patient was hospitalized and the condition resolved. They were taken off the statin, and I saw them about a year and a half after that hospitalization. Again, the person seemed to have been terrified by what had happened to them and complained of pain all over and inability to exercise at all. And their examination, other than extreme anxiety, showed no evidence of physical disease. Another patient who seemed to have been stuck in a state of terror that would not resolve, and they could not resume their normal life. Now, for the third example, I'm going to talk about a patient I saw who had a non-life-threatening condition that they didn't seem to be able to move past. This was a late middle-aged person who had fallen and broken their left wrist. They were right-hand dominant. The fracture was treated with reduction and casting, and this had occurred about 3 years before I saw them. On examination, the wrist was not deformed or swollen, it was not tender, and the patient could put it through a full range of motion. However, they told me that they could not use the left hand at all because of severe pain. The physical examination did not support that assertion, but the patient seemed to have permanently given up on using one of their arms and hands. Finally, I saw a younger patient who, a little bit more than 1 year prior to my seeing them, had been in a very serious automobile accident where they'd suffered multiple bony fractures, a pneumothorax, and internal abdominal injuries requiring surgical repair. I have a saying which is, wounds heal, and as far as I could see in this patient, all of their wounds had healed satisfactorily, except that they'd had an acetabular fracture and probably had some post-traumatic arthritis in a hip. The chest wall injuries were resolved, they could breathe normally, and they had no abdominal problems. Again, the patient complained of severe pain in every body part which had been injured over a year ago, and told me that basically they could not perform most of the activities of daily living that they'd been able to perform before the accident. And aside from a mild gait disturbance, I could see no objective signs of limitations. So, to summarize, each of these patients had exhibited what I call medical catastrophization. They each had had a medical problem that was real, not imaginary, and in 3 out of 4 cases was quite serious. In each case, their condition had been treated and had pretty much resolved. However, in each case, the patients seemed to be unable to accept that their condition had resolved and seemed unable to move on with their life and resume their normal activities. Well, I hope this has been helpful, and as usual, remember, if it happens, it's possible.